talk about what Obamacare is not. Obamacare, you may remember that 2 years ago when the Democrats were preparing to pass this massive piece of legislation, they made several key promises, and I'm sure you can all recite them, but we'll just review them because it's important to see where Obamacare actually fails. Just 2 years in, we already know the Democrats have broken all of these promises. We were told by President Obama that Obamacare was budget neutral. And there was a lot of trickery going on with the way that the Congressional Budget Office was calculating things. Now we find out, which is not a surprise to us, but we do find out it's not budget neutral. One of the other justifications for why Obamacare had to be passed, you'll probably remember, was that we needed to have universal coverage. Now we find out that even after we pass Obamacare, we're not going to come even close to having universal coverage. Nancy Pelosi, who was then Speaker of the House, promised that because of Obamacare, we were going to see a huge reduction in healthcare costs. Also, not true. And one of the promises that they had made was that families would see a decrease in their costs, and the entire United States as a whole would see a decrease. Both of those are false. And the other thing, President Obama very famously said that if you like your doctor, if you like your health insurance, you can keep both of them. That's not true. And for the hundreds of thousands of Americans who are already losing their health insurance and realizing not only are they not going to be able to keep their health insurance, they're not going to be able to keep the doctor either. Okay, just a few quick facts. Obamacare works by forcing Americans to buy approved health care. And the definition of approved health care would probably surprise you because most of you do not have what the government deems to be approved health insurance. It forces companies to pay for health insurance for employees, which on the surface may sound fairly benign, but in reality, it stifles companies' ability to hire when they're told not only that they have to provide coverage, but they're told exactly what has to be in that coverage. It creates new entitlement programs. It causes new financial burdens on states, and we'll get into that a little bit later. And it expands Medicaid. Many of you have probably read that the way that Obamacare works and the way that it tries to expand coverage is by dumping people into Medicaid. So people who are currently enrolled in private health insurance, they're going to lose that health insurance and they will be dumped into Medicaid. And Medicaid, as we all know, is a program that is a complete failure. It is the perfect example of government's inability to provide quality health care. People who are in Medicaid have poor health results. Study after study shows that they're less satisfied, and even with these poor results, it's a massive part of states' budgets. Most states spend 24% of their entire budget on Medicaid. It's more than their prison systems. For Ohio, it's more than you spend on education, and you're going to see that increase because as a direct result of Obamacare. Okay, so we're going to get into the specifics of how does Obamacare affect Ohio, because so much has been written, and almost every day you can open up the pages of the Wall Street Journal and the Washington Post, and you can read about the impact of Obamacare on America. But when it comes to the state-specific facts, it's really important to make sure that you are aware of what's happening in your local government. Okay, Obamacare is going to negatively impact Ohio's families, and I'll walk through just a few of the ways. New taxes. The taxes that working families are going to have to pay just to cover that Medicaid expansion that I just mentioned, it's a significant burden. Loss of health insurance. Families who can expect to see loss of health insurance will be those who make above the poverty line and who probably at this time have private health insurance, but because it's cheaper to dump them into Medicaid than to pay for all of the new provisions of Obamacare, you'll see a lot of those types of families lose their private insurance and just get rolled into Medicaid. Child-only policies. This is something that a lot of people do not talk about. The media has been very reluctant to talk about child-only policies. For those of you who do not know, child-only policies are plans that are extremely helpful for single mothers, for example, and for lower income families. It's a way to make sure that your children have continuous coverage. So if one parent loses a job, you can get a child-only plan because children are typically very cheap to cover, especially healthy children. In 33 states now, it is impossible to get child-only coverage because Obamacare says you cannot provide child-only plans unless you cover every pre-existing condition, which makes it economically impossible for most insurance companies to offer these plans. Because if you have to provide coverage for a baby who is born with some congenital health problem, you've completely skewed the numbers. So what used to be an option for lower income families doesn't exist anymore. And that happened almost immediately. That happened in 2010. Nobody talked about it, but it was a direct consequence of the Obamacare's failure to foresee that exact problem. Higher premiums. When I go around and talk to groups, a lot of people actually have already received notice that their premiums are going up. And that's true for a lot of people. A lot of small businesses have seen their rates go up, and you can expect more of that in 2014. As I mentioned, lower income families are going to be especially hurt by Obamacare. Mini-med plans they're the exact inverse of high deductible plans. So a mini-med plan, if you're working at McDonald's, for example, you have the option to purchase what is called a mini-med plan, and it's a way that you can, for a very low monthly premium, you can get basic things covered, including children's annual physicals. Obamacare says, nope, that's not adequate coverage, and it actually outlaws something that the private market, the private sector had created, and it was working. It was working for hundreds of thousands of families. Many of you may have seen that last year, Congress made representatives from McDonald's come to a hearing to actually defend why they were offering this plan. It was an absolutely absurd moment because you have here a member of the private sector who creates jobs, who's offering a health insurance plan that his employees like and they're purchasing. And Senator Barbara Boxer is telling them, we don't like it and we're outlawing it. The other thing is, Obamacare makes it much more difficult for low-income families to purchase health insurance that fits their unique needs. This is part of mini-med plans, but it's even broader than that. There are a lot of health insurance plans that don't cover everything, but they cover basic needs. And for low-income families who are trying to make it and trying to stay off of Medicaid, they are absolutely the best free market solution. And again, Obamacare comes in and guts those. So here's a demographic that, again, will be damaged by Obamacare, and that is seniors. Currently, there is 16% of Ohio's population enrolled in Medicare. By the end of this decade, because of Obamacare, Medicare's payments will fall below 75% of private insurers' rates. Just so that you can get an idea of what that means, a lot of doctors don't accept Medicaid because the rates are too low. Seniors are going to be offering that same rate. So you're going to see a lot of doctors saying, we can't afford to see Medicare patients. payments to doctors will be cut by almost 30%, and that would be